My name is Shivam Gupta. I'm a assistant scientist in the Department of International Health. I work on the Bloomberg Global Road Safety Program, and I manage the work, our M&E monitoring and evaluation work in India, Turkey, and Russia. So the session this afternoon from 3:30 to 5 is on monitoring and evaluation for road safety. We have 3 speakers for this session, like the other sessions. So without further ado, I would like to introduce our first speaker, Dr. Leilei Duan, who is the Director of Injury Prevention in the Chinese National Center for Chronic and Non-Communicable Disease Control and Prevention in China. She's been with us for a few days now, and she's going to talk about the National Injury Surveillance System in China. So, Dr. Leilei. Your PowerPoint should be here. And here we
use this one. Is it?
either of those, this
Okay.
or this.
Thank you, Shiva. Everyone, good afternoon. I'm so honored to be here to introduce about injury surveillance in China. We call it National Injury Surveillance System. My presentation will be these elements: background, injury surveillance system, utilization of the data or the information of it, challenges, limitation, next step, and experience. So first, I will talk about the background of injury status in China. There's some data figures on it. This one, I will point out that this rate is without the missing report adjust, before the missing report adjust. For this one, injury ranked the 4th death cause of whole population. And at the same time, and very important, injury was the 1st death cause of children, young people, and the working population in China. The incident rate of injury is not so clear because by now there's no whole nationwide survey about injury incidents. So it's composed by different areas survey about injury incident. So it ranged from 16% to 21%. And how about the disease burden of injury? We are now working with IIRU about using GBD indicator to assess the injury disease burden of injury, and hope it will be released next year. So we will go to a colorful table. It's one I loved very much. So it will show the very clear how about the different age group, how about the position of the injury. So we can see that from 5 to 44, injury ranked the 1st death cause of the population in China. And we can see there's a lot of colors here. So it influenced this population very much. For this one, it's the trend of all different important kinds of diseases for different age groups in China. We can see the red one, yes. Also very similar as the colorful table, from 5 to 45. The proportion of injury death is very much. And goes to the life expectancy. We finished the discussion together with US CDC and published that paper recently. We can see that if we eliminated the injury, we can save 1.36 year for the whole population. So it will contribute a lot if injury be prevented well. So now we were thinking, how about the public health 4 steps approach? We call it the 4 steps approach. We will think about what's the problem, what's the risk factor, how to identify the risk factor, and which one works, and also how it's done. So it's a very useful steps approach for our all public health population. So we use the words from the Preventing Injuries and Violence, a guideline for ministries of health, published by WHO. It is said health ministries and its partner agencies should ideally collect the following information as below: deaths from injury and violence, non-fatal injuries. So it's what I will talking about for our NISS: disability, adverse health consequence, geographical distribution, and economic cost of that. So I think we are all very familiar with this table. It's in the guideline of injury surveillance of WHO. We can see that which one is the best one can collect all kinds of injury-related information. Which one? Yes, the first one. Household survey can collect from injury, no injury, and report injuries to deaths. And which ranked the second? We can see this one, emergency department. It can collect from mild to death, different kinds of severity injuries related information. So what I will talking about is the emergency department-based surveillance system. What's the history of our national injury surveillance system? I see, maybe we should see that it began from last century from Zhejiang. There's a study, just a project to test how to collect injury-related information from emergency department. And after China CDC established in 2002, we began a pilot study in 11 provinces to test the working mechanism and the data collection instruments in about 70 hospitals. After 3 years pilot work, the former MOH, now we call it the commission, the new name, issued and released a formal document to announce that to establish the National Injury Surveillance System. So it's a nationwide, hospital-based and passive injury surveillance system. So it's the name. It issued in 2005, so after 3 years pilot. We can see this map. There's stops. The blue one is rural one, and the red one is urban one. So totally 43 sites be involved in this system. What's the size? Means district or county. So totally 129 hospitals, but several hospitals changed, combined, and disappeared. So totally now 126 hospitals involved in this system. This one, maybe they're very familiar with this one because they went to our surveillance sites and surveillance hospitals to see how doctors and the nurses using this instrument to collect injuries-related information. So it included the identification information, demographic information for the patient, and the basic information of injury event. For example, the mechanism, how, when, why, and also the clinical information, the severity, the nature of that. So it's just a one page. Some of the hospitals use their hospital information system. It's an electronic form, and some of the hospitals still use the paperwork. How the information be transferred or delivered to our center from the surveillance hospital. Here, you can see that when patient visit hospital emergency room, the doctors or nurses will fill the information collection form, and related department of the hospital will be responsible for collecting all the forms and input the forms to the data set and submit the data set to local CDC and then to provincial CDC. Provincial CDC will submit the data to China CDC. It's step by step. And the future, I think, will be maybe the online one. But why is it so difficult? Because IIRU is not like that information collection. That is not so much. IIRU, too much, very much information. And there's quality control, standard quality control method and protocol for all the different level CDCs to working according of. Because China CDC is quite different from US CDC. There's only one CDC in US, but there's a lot of CDCs in China. There's national CDC, provincial CDCs, city level CDCs, and county level CDCs. So all the surveillance work related CDCs will be trained by the standardized working protocol to how to collect the data and how to do the quality control work. So, and we will do different level supervision and evaluation to assure that the data will be high qualified. There's national level supervision or monitoring work. She is the director of our center. She is me. You may be very sleepy now. So and in last year, we finished a nationwide evaluation for the whole IIRU surveillance system, not only the data, but also the work, the capacity building of the team, the data collection, the quality of the data, and how about the utilization of the data, and so on. It's a comprehensive protocol how to evaluate the IIRU surveillance work. And we can see the data trend from 2006, the first year, to 2013. When Erin and Dave went to the surveillance sites in Hebei province, Erin asked me a question: how you can let the doctors and the nurses buy in this work? Because in some countries, they will not do this. It's so hard and it's so boring for nurses and doctors to finish this paper after the treatment. So I think it's special in China because we have the formal document, the official document, a formal document, and also we have the responsibility. All the CDCs have the responsibility, and also the hospitals have the public health responsibility. Even this, they shouted at the very beginning, Dr. Duan, we cannot do that. It's so boring, so many information we could lack. But you can see that at the first year, the missing report is very high, more than 50%. So after the training, after they practice and familiar with all the instruments, the data, the collecting work and quality of the data improved a lot. You can see that, not only doubled of that now. Because our national IIRU surveillance system is not population-based, we can just calculate the proportion of each indicator. So it's the now stage what I will talk about the limitation of this system. But we can not answer whether it's because of the improvement of the quality of data collection or the incidence raised. Maybe we will answer it next year. I will talk about that later. So how about the development of NISS? There are 4 important points. First one is integrated IIRU surveillance. Second one is product-related IIRU surveillance system, quite like NICE in US, established by CPSC. And third one is modified injury surveillance report card. I discussed with Professor Heider about we add one important indicator to about alcohol use and add a small modified of the data collection firm. And then, very important, is National Injury Surveillance Extended Injury Information Collection Program will include different kinds of injury in detailed data collection, totally eight kinds of injury. This injury pyramid, everyone who worked in injury area should know this definition injury pyramid. So last year when we had a meeting in Manila, Dr. Etienne Krug showed very amazing pictures finished by New Zealand, a set of pyramid, different kinds of injury, very, very amazing pyramid. So we should know what's the pattern and the profile of different kinds of injury. And so we should know at the top of that is the death and the inpatient, outpatient, and to the primary care, and I reported. So for different layer of the pyramid, we will collect the data from different data resources. So we have finished the 14 sites pilot work of that. Try to describe the injury pyramid for each site. It will be very helpful for injury prevention strategy identification or the resources allocation of that. So for product-related injury surveillance system, we collaborated with AQSIQ. The name is so long. General Administration of Quality Supervision, blah, blah, blah. So long. And we began our collaborating work from 2007. It's very interesting. It's opposite of US. In US, CPIC established NEISS, National Electronic Injury Surveillance System, for product injury-related information collection. And from 2000, US CDC collaborated with CPIC and established NEISS AIP, All Injury Program. So they collaborated based on the NICE. So in China, quite similar. We began from 2 sites, 6 hospitals. Now it's 11 sites, 32 hospitals. So you can see that quite similar as the data collection firm of our NISS, but just, disappeared. There's product-related information collection indicators, maybe 5, totally 5, based on the all injury collect indicator. If you are interested in that, you can ask for that from me. And how about the EIICP, the Extended Injury Information Collection Program? You can see that this one is road traffic related injury data collection. This one is force and drowning, and dog bites, poisoning, violence, suicide, and e-bike, totally 8. We released that formally by China CDC to all CDCs in China. If they are interested in some or all of this, they could add the supplementary data collection firm to their surveillance work. And we have the English version of that. If you want, you can ask for that. And we have initiated our testing work together with US CDC for the road traffic injury one and the e-bike one, like electronic bike, very famous in Asia. And how about the utilization of injury surveillance system? You can see that there's a report, there's paper in journals, and so, and also the data will be used in the National Report on Injury Prevention, Healthcare China, Health China 2020, and also, you are very familiar with this? This one, it showed this morning about global road safety status report using the NISS data of that. And also, this one is a very famous document released by Chinese State Council about quality development strategies, national. So there's one point is China should establish product-related injury surveillance system based on our collaborating work. And our injury surveillance data also be used in identifying the priority of injury prevention and also the injury prevention evaluation. For example, in Shenzhen city, very famous and a developed city in China, they find that from their emergency room injury surveillance data, dog bite ranked first of all the cases. So they initiate a dog bite prevention intervention project from last year. So we will go to the challenge of to establish and managing a injury surveillance system. I think maybe all the all countries who are running an injury surveillance system will face this problem. First one is the team building. How to make sure that they will use the standardized protocol. How we can ensure the information will go to the director to the doctors and the nurses. And also collaborating between public health system and hospitals, different area. Even we are all in health area, but they are different. And the budget, always the problem. Quality improvement and the data utilization. So I think they are the challenges, but also the point that we can collaborating on. The limitation. So I just mentioned about that it's not population-based. We cannot calculate the incident rate by data. And also, it's not a total random sample. So how about next step? First one, we will improve the sampling strategy next year and at the same time expand the number of the hospital to 70 sites and more than 200 hospitals from next year, and improve the data utilization, extend the cooperation. You can see that it's now the map, and the next year it will be this kind of. And also the utilization of data from the injury surveillance will be stressed as overall injury burden and the specific injury burden by age, sex, and the geographical area. It will be released next year. And also the link of the data pool from police, between police and us. Now they are open the door a little that we can collaborate with them. And also product-related injury collection. Risk factors, we have a national risk, NCD-related risk factor survey every 3 years. There's including injury-related behavior risk factors. So it's helpful for us to improve our data utilization. And also we extend our cooperation with disability-related sectors and the international organizations, university, and other companies and medias. We launched a very big campaign on elderly falls prevention with the CCTV in China in October to promote the falls prevention. And what's the experience? What is a good surveillance system? You can see that cost-effective, systematic, scientific, complete, reliable, persistent, they are the characters of a good surveillance system. And how to establish a good surveillance system? We should say that fully prepared, just there's a fully pilot, capacity building for the whole team, the quality control, standardized the quality control protocol, and the scientific methodology to collect the data and hard work for all of that. Thank you.